So what else could we do? Let's suppose you're somebody who cares and you want to see the world change for the better. Well, another thing we could do is we could get nutrition taught in medical school. And this is something we've been working on. So first, the bad news. The average physician in all their years of medical school in the United States gets less than 19 hours of nutritional education. And most of that is focused only on understanding specific nutrient profiles and diseases that are caused by not getting enough of them. None of it really looks at how to help patients eat well. My own aunt went through chemotherapy. She had bladder cancer, had to have her bladder removed. It was a really scary time. We didn't know if she'd make it. I am so happy to say she made it through, and she's alive and well. The bad news is that not once in all of her journey did any of her oncologists say one word about food. Only one time, actually, she even heard about food. She was sent off to a marijuana dispensary to help get her appetite back. And they said, oh, you might get the munchies. You should have some cookies. That was it. Otherwise, nothing about food in the entire journey. Now, we know for a fact that her chances of recurrence are much higher if she doesn't change her diet. We know this. And I'm sure her doctors thought that they were being kind and loving to her by not wanting to disrupt her life, by telling her she could just go on doing what she loved. They wanted to make her life easier in a time of incredible stress. But here's the thing, I don't think it was making her life easier to set her up for recurrence, because she was going through all this suffering of chemotherapy and debilitating surgery because she wanted to live. She didn't want to die. And I think that for a doctor in that situation to not say a word about food with all that we know today is bordering on malpractice. But here's the thing, her doctors probably didn't know, for real, because they didn't learn about it. Because out of every medical school in the United States, do you know how many have a single dedicated faculty to focusing on nutrition? 5. Out of every medical school in America. Only 5 have one single staff member who's focused on this. So it's being treated like an afterthought. But we got to thinking, why? And what could we do about it? So we reached out to the American College of Lifestyle Medicine, which is a fabulous organization that's helping to pioneer and champion bringing lifestyle medicine into medical practice in America and around the world. And we said, what's going on here? And I talked to Dr. David Katz, who founded ACLM. And he said, well, the schools teach to the test. And the tests are administered by the National Board of Medical Examiners. And we dug a little deeper. Turns out there's about 10,000 questions in the MBME question bank that are given to medical schools in the United States. And they pull from those question banks for all of their graduates to test them to find out whether they're going to be able to become licensed physicians. How many of those 10,000 questions do you think relate to diet and lifestyle and helping patients eat well? None. So we started a petition to the National Board of Medical Examiners. We said, hey, look, food's kind of important. You're kind of behind the times on this one. And you have a responsibility to drive this conversation, because the medical schools literally have to make it harder for their graduates to pass your tests if they're going to add curricula that actually distracts from the data they need to be able to memorize in order to pass the tests. And so the NBME essentially said, all right, if you'll give us questions, we'll add them to the bank. And at first I was annoyed because I thought, well, won't you even write your own darn questions? And then I thought, this is actually great, because you know what it means? It means the American College of Lifestyle Medicine gets to write the questions. And that way we know they'll be smart, because the ACLM is actually reading the data and paying attention to the latest breakthroughs. And so we ended up taking on a fundraising drive. It was going to cost $250 per question. We wanted to raise enough money for 1,000 questions so that 10% of the bank would be diet and lifestyle based. $250,000. And I am pleased to tell you that as of December 31st, we hit the mark. So now the ACLM is hard at work working with the American Board of Lifestyle Medicine. There are 30 qualified senior researchers that are out there right now writing questions for this bank. And by the end of 2020, we're going to have these questions in use in medical schools in the United States.